Hello, everyone. Wasn't that a wonderful time with Seth, Marcella, and Emily? I hope you enjoyed that. This presentation that I'm about to do about how to have more effective medical appointments, this is going to be one of those interactive presentations. And so I need you to go to menti.com right now. So that's www.menti.com and use the code 38411523. You can see this information at the top of every one of my slides. So if you weren't sure what I just said or trying to figure it out by getting over there, just look at the top of my slide. The information is there. I am Shani Weber. I'm the Community and Advocacy Director for the Ehlers-Danlos Society, and I'm so excited to be here. I hope that you're enjoying this great conference. Now, if I can get my slide to advance, we'll see. Tech team, I need to come back out if I can to see if we can advance this. It's not letting me go back out either. I apologize for this little glitch right here. You've got to love technology, right? But we can start talking about having effective doctor appointments while I keep pressing buttons on my laptop. I know what it's like to go to a doctor's appointment, feel like you're not being heard, you're not being seen, you're not being believed. That's really hard, isn't it? And because many of us have so many symptoms, I'm going to stop share and come back out. Because so many of us have so many symptoms, we see a lot of doctors before we even know about these conditions, as we're getting diagnosed and as we seek management care. And so let's see if that worked. No, it's not. Tech team, can I please have advice on how best to address this when the slides are not advancing?
Am I on? Okay, hi Shani, it's Lara. Right. Just to say, can you hear me, Shani?
I need to do this Shani?
Can you hear me, Shani? Shani?
With doctor appointments, we want to have more effective doctor appointments. And that starts with,
can you hear me?
Which doctors can we see? We need to be able to go to doctors. We'd like to be able to see the ones that specialize in EDS, but we're not able to go where the EDS experts are in our different countries. Oh my goodness, I got it working. Here we go. We're going to have to speed through. All right, so hopefully with all that time I was fiddling with my PowerPoint, you had an opportunity to get over to menti.com and put the code in, right? How many doctors and therapists do you see a month? Okay, I'm saying most are saying anywhere from 0 to 2. Oh, 3 to 5 is coming up. Okay. But we do have some people that see 6 or more doctors or therapists a month. That's how many times we are sitting in waiting rooms and having these interactions. I love this. I love this participation. But how do we get the care that we need?
Hi, Shani, can you hear me?
These are the basics. Look at this because this is what we're going to talk about in this presentation. It's about having reasonable expectations. You've got to collect data before you even get to the appointment. You have to figure out what is it that you want to achieve in the appointment. What's your goal? prepare an agenda for the appointment, communicate effectively with the doctors and therapists when you see them.
Shani,
And
it's
then there's a
Alan
whole
here. I
bunch
don't
of
know if you
do's
can
and
hear me.
don'ts that can really affect the care that you get. All right, so let's start with reasonable expectations. On the left side of the slide, you can read through some really unreasonable expectations. When we have unreasonable expectations, then our expectations are so high that we get very disappointed and even angry and frustrated with the care that we're getting. When it may be that our expectations are too high. In the world of medicine, they haven't gotten to the point to get us completely pain-free all the time, right? But a reasonable expectation is, can I manage my pain well enough so that I can function, so that I can do what I need to do in the day? An unreasonable expectation is every doctor you see is going to be an EDS and HSD expert. But a reasonable expectation is that at least they'd be willing to learn about EDS and HSD, right? That's a reasonable expectation. Think about, what are your expectations when you go to the doctor's office? Are they reasonable? Oh boy. It reverted back, didn't it? But here we go. We're moving on. You know how I mentioned you need to collect data before you ever even get to that appointment? Doctors and therapists are problem solvers. But they need information. They need data to help solve that problem. So when you're collecting data, look at it as, what are your symptoms? What makes it worse? There we go. Let's see if this will work. Hang on one second. There's just a little tech problem. It's saying that I can't share my screen because another person, me, is already in share screen. So let me see here. If we can get, all right, now I think you can see it. What it looks like is that from Mentimeter. All right, there we go. When you share your data or take your data of what your symptoms are, when do they start? What makes them worse? What are you doing to manage your symptoms and how is that working? Then you can turn it into a graph or a list, because that's an easy way for your doctor or therapist to see the information that you got, right? This is a line graph. If you took data about when you had pain, maybe on a scale of 1 to 10 over 7 days, that's the green line in this graph. Do you see how it goes up and down? You can show your doctor over a week, here's how my pain was. Or here's how my mobility was, how well I could move around. Or here's how my swelling was. It was really bad at the beginning of the week, or it went down. But you can do this for treatments too. This is just a sample of treatments, not for EDS in particular, but just to show you the graph. Did a treatment start working and then stop being as effective? Did another treatment you tried start really not being effective, but the more you used it, the more effective it became? How can you show your data? You know, if you're a tech person, you don't have to do this with a pencil and paper. I'm old school, and so I still use a paper and list it out. But if you're comfortable with technology, what about tracking your symptoms on an app? Some of these apps convert your data into a chart or report that you can share directly with your doctors. You can email it or put it in your patient portal, the information from the app. These are just some of the apps that are available for your Apple users and your Android users. An appointment goal is important to decide before you go. Why are you going to this appointment? This is decided by you. It's going to direct how your care goes. Why are you going? Is it because you want tests to be done? Are you trying to investigate a new symptom? Or are you seeking a referral to a specialist? Do you have symptoms that aren't well managed? And so your goal is to talk about different treatment options to better manage your symptoms? What is your goal for this appointment? Before the appointment, you want to create an appointment agenda. On that appointment agenda, you're going to write down your goal, the goal that you just decided. Why are you going to this appointment? You're going to write down any medications and supplements that you take, as well as any relevant history. What relevant history means is if your goal is to investigate why am I having headaches, then relevant history might be, what is your history with headaches? What diagnoses do you have that are known to cause headaches? What's relevant to why you're going to this appointment? Then you're going to write down symptoms, your new symptoms, the ways you've tried to treat it and how that worked. In other words, you're writing down the data you took, you're summarizing it. And then if it's something visible, think about sharing a picture or a short video as well. A picture, shares a thousand, shows 1,000 is better than 1,000 words. It'll come to me in a moment. And so think about, because our appointments are so short, how can you quickly get this information to the doctor? More information that can be given quickly and that you can discuss with your provider means the more problem solving that can occur during your appointment. This is an example of an appointment agenda. This is what it may look like before you go to the appointment. You fill in the date of your appointment, what doctor you're seeing, but you leave blanks for what information may be obtained at the appointment. Maybe they'll take your weight, your blood pressure, or your heart rate. You write down your goal on your agenda. You write down your diagnoses. You write down your current medications and supplements and vitamins you're taking. Those are important too, because they can interact with medications. You write down any health issues that are new since the last time you saw this doctor. They have records of your last visit. They know what was happening when you last saw them. But what's new? What did you try to treat those symptoms? Did it work? What symptoms did the treatment help with? Did it cause side effects? Include that. Always leave a place for notes and a place for questions. It's best only to ask a few questions at the appointment because they are short appointments. And so what is most important for you learning at this appointment today? When you go to the appointment, then you can fill out the information of what they took. You can fill out notes of what you and your doctor discussed. Maybe during your discussion, a couple more questions occurred to you. So not only do you write down the answers to the questions you had, but maybe you thought of another question and you want to write down the answer to that too, so you don't forget it. I find that you really need to write down or record what is being said with our fatigue, with our pain, with our brain fog. It's easy to forget what's being said. You can bring somebody to the appointment with you when we're not in a pandemic, and or take notes yourself. What was shared at that appointment? Okay, I'm going to go through some basic important things to consider at that appointment to help your appointment go better. You want to bring a copy for your doctor as well of your appointment agenda so that you're both looking at the same thing. But that also means your appointment agenda will be entered into your medical records. Tell the doctor in the beginning of the appointment what your goal is. Why are you there? What is the reason for your visit? Share your data. When not in a pandemic, think about bringing a friend or a family member with you to be an advocate, to be an extra set of eyes. I know during the pandemic, a lot of medical centers have prohibited more than one person coming back into the exam room. And so this has been more difficult. But when things become more normal, think about having somebody go with you. But certainly take notes or ask to record the appointment. It really is too hard to remember everything. When you're talking with your provider, be very specific. What are your symptoms? How often is it happening? And what problems does that cause for you? For example, instead of telling your doctor, I have headaches, that doesn't give your doctor a lot of information to go on, to problem solve. And after, oh, that's what you want. You want problem solving, right? If you're more specific and say, in the last month, I have had 7 headaches, all at the base of my skull, with stabbing pain above my eyes, which disrupted my sleep and ability to drive. By being specific, you have given that doctor information about how often is this happening? Where is it happening? And what is it affecting? That's a lot more information for your doctor to work with to try to help you with that symptom. So we're on Mentimeter again. Hopefully you're still there. It's the same code. What hurts right now? What hurts the most? Because I know a lot of us, we have pain all over, don't we? What hurts the most right now? Oh, I see head and neck. A lot of people writing that. But there's also, the right abdomen, upper quad. The right hip really is hurting right now. And jaw. Oh, yes. Knees and shoulders. Everything. It's 6 a.m. where this person lives. I love that. Truth. My left knee. Notice that neck, back, head are having more people say those than any other body part. Isn't that interesting? Back and neck. Those are very painful parts, aren't they? Back and neck. Yes. Wrists, ankles, cervical spine. Look at this. I love the word cloud that you made. This all hurts. But I love particularly the answers that were very specific, right? Neck and back and head are the most common answers, but look at what some of the answers are very specific. The back of the head, the cervical vertebrae. I love when you use specific words. That helps doctors know how to help you. It helps them problem solve. I love that. At the appointment, remember to do these. It's really not where you're bringing all your emotions and looking for validation. That's best for family or friends or for your therapist. At the appointment, time is short. It's really about problem solving. Be a good manager of time. Make sure that whatever your appointment goal is, that's the focus of the appointment. This is key. If you don't remember anything else about my presentation, remember this. Be open to trying different treatment options. If you say no to every treatment option that your doctor or PT or therapist offers, if you say no to every single one, they can't help you. Their toolbox will be empty, right? It's important for all of the painful things that you listed in that word cloud to have a toolbox of ways to manage that pain, right? This is the same with other symptoms. You need to have multiple tools to manage those symptoms. And so be open to different options that your doctor presents. I just want to mention the ER or the A&E if you're in the UK, the emergency room, the emergency department, because sometimes we end up there. The emergency room, their entire role is to stabilize patients, to either be referred back to their local doctors or to be admitted into the hospital. It is not where you get the best care for treating symptoms. There are times to go to the ER. I'm not saying don't go to the ER. For instance, if you're having severe chest pain, you're vomiting with shortness of breath, or a sudden sharp abdominal, chest, or pelvic pain, or you're suddenly bleeding and you don't know why, or you can't get it to stop, or you're not breathing, you have your lips and nails are turning blue, partial paralysis, loss of vision, sharp flank pain, broken bones. There are reasons to go to the emergency room. Know what those reasons are. Now, here's something that we are very easy to forget. Please remember your regular checkups. Yes, we are zebras. Yes, we spend a lot of time looking at our EDS and our HSD symptoms and managing them. But there's a little bit of horse inside us. We are humans first. Remember your regular human checkups. Investigate any new symptom. Don't assume that it's caused by your EDS or HSD. Unfortunately, we do know people who assumed that every new pain and symptom was their EDS or HSD. By the time they investigated it with their doctors, they had been diagnosed with stage 4 cancer. I want you to look at these red flags. If you are seeing a doctor who's condescending, unwilling to answer questions, unwilling to explore treatment options, is disrespectful and not respectful of your time, those are red flags. That's maybe not a doctor you want to be with, but I want you to notice these are also behaviors some patients have. Doctors are not as excited about helping patients who are unwilling to answer questions or condescending or disrespectful or unwilling to explore treatment options or discuss concerns. This goes both ways. I'm going to go through these very quickly because I'm at the end of my time, but you will have the recordings for my presentation starting tomorrow that you can go back and pause when these slides are up to read them more carefully. A lot of patient do's and don'ts. I'm going to skip through that. I want to thank all of you. I know going to see doctors and therapists is hard. I know that, but we can have better appointments with reasonable expectations, with setting a goal, with collecting data, having an appointment agenda, and being open when we're communicating with our medical team. Thank you. My email is there, and feel free to contact me if you have any questions.